and welcome to Docplexus News. Let's go through this week's healthcare headlines that matter. Very soon we may see MBBS and AYUSH doctors performing critical surgeries. To combat the shortage of doctors, the Health Ministry proposes MBBS holders with a certain diploma to perform surgeries, anesthetic procedures or C-section. Moreover, AYUSH practitioners and nurses will also be allowed to do deliveries and non-invasive abortions. Taking notice of the MD-DNB equivalence issue, the Health Ministry has now directed the MCI to regulate its teacher eligibility qualifications. The Health Ministry recommends to delete the 3-year junior residency and specifically mention DNB along with MD-MS in the academic qualifications for various faculty posts. Overruling the decision of the central government, the Supreme Court has now allowed the 4D barred MBBS college to admit students. The verdict came after a plea was filed by medical college management. The court has observed the government decision as cryptic and mechanical order which does not stand a chance for jurisdiction. The Madhya Pradesh government has cancelled MBBS and BDS admissions through NEET 2017. The decision was taken after the Supreme Court rejected the state's plea on admissions of non-domicile candidates. The court has further directed the state to redraw the merit list and complete the admission process in 10 days. Meningitis can kill in hours, yet the current way to positively identify the infection takes about 2 days. However, Queen's University research team has developed a loop-mediated isothermal amplification test to detect meningitis in just 60 minutes. This test can use blood, spinal fluid or nasal swab as a sample. A new interleukin beta inhibitor drug, canakinumab, is claimed to reduce the risk of heart attack by 1/4. According to the study, canakinumab at a dose of 150 mg every 3 months reduces recurrent cardiovascular events independent of lipid level lowering. The newly introduced Maharashtra Shop and Establishment Bill includes doctors and hospitals in its definition. The bill is in contrast with the previous court's judgment of not considering medical practitioners for commercial establishments. However, if the bill is cleared, doctors and hospitals will have to register online under the Act. The Supreme Court has declared that a patient has right to refuse life-prolonging medical treatment. The court also clarifies that a woman's freedom to bear a child or abort her pregnancy also falls within the right to privacy. Neither the state nor the private person holds any right to intrude the right to privacy. Gifting health cover to all citizens in Karnataka, the state government has brought a Rajiv Arogya Bhagya scheme. Under this scheme, the patient need not pay a single rupee for treatment. The scheme is expected to benefit 1.4 crore households in Karnataka. Giving justice to a plea for patient's death, the National Commission has recommended that the hospitals are equally liable to pay if consulting doctors are involved in medical negligence. The Commission has re-emphasized the Supreme Court's verdict that the hospital cannot discern responsibility whether the patients are treated by their own doctors or by visiting consultants. In the wake of recent monsoon havoc in Mumbai, the municipal corporation has released guidelines for treatment and prevention of leptospirosis. Docplexus has made an effort to give more insight about these guidelines and invites you to visit our website for more information. These were the latest happenings in the medical field brought to you by Docplexus, India's largest and fastest growing online community of doctors. Stay tuned for more every Thursday 6 p.m. Happy Docplexing!